So, good evening, good morning, good afternoon, everyone, based on your time zone. I'm Dr. Fatin Hamid. I'll be the moderator of this session today. It's truly my pleasure to welcome you all in our today's webinar. Our session today addresses a topic of great importance. It's about how action research transforms healthcare operations management as healthcare systems around the world face interesting demands for efficiency, quality, and patient-centered care. It's essential that we explore innovative approaches that bridge theory with practice and bring about measurable improvements. Before we begin, I would like to note that all participants will receive their certificates of attendance by email following the webinar. Also, to mention that at the end of the session, we will have a Q&A segment, and I will be the moderator. I will be moderating the questions. So please feel free to type your question on the chat box, and I will be choosing like 5 questions to answer them, or 3 to 5 questions to answer them at the end of the session. Today, we are honored to have you, Dr. Muhammad Salam. Sorry. So, our distinguished speaker, whose career and contributions have significantly impacted pharmacy practice, healthcare management, and academic collaboration. Dr. Salam brings with him over 25 years of expertise in pharmaceutical and healthcare management. Since 2003, he has been serving as a pharmacy manager and head of department at Mediclinic Middle East, MCME, in Dubai, UAE.
I believe you are muted, Dr. Fatan.
No, I'm not muted.
All right. Okay.
Can you hear me?
Yeah, now it's fine. Yes, thank you.
Yeah. So, Dr. Salam, he has been serving with the pharmacy manager and head of department at Mediclinic Middle East in Dubai, UAE, while he also contributing to academia as an adjunct assistant professor at the College of Medicine in Mohammed bin Rashid University of Medicine and Health Sciences. Dr. Salam holds a PhD in healthcare management from the International American University, USA, and a master's degree in pharmaceutical sciences from the University of Jordan, complemented by a rich portfolio of professional certifications, including Six Sigma Black Belt, ACRP Certified Professional, Certified Purchasing Professional, and Good Clinical Practice certificates. Dr. Salam has received multiple awards for his substantial contributions to quality and patient safety and academic collaboration with UAE universities. He is also a member of the College of Pharmacy Advisory Board at various universities and IVPN clinical research. Dr. Salam is extensively involved in teaching and has published many research articles. Last but not least, in 2025, he was selected as one of the Middle East's most eminent leaders in the pharmacy and healthcare management. Today, Dr. Salam will be sharing insights from his work on action research and healthcare operations management from observation to action. His presentation will highlight how participatory action research can bridge the gap between theory and practice, transforming healthcare systems by improving processes, enhancing patient outcomes, and empowering healthcare teams throughout real-time problem solving. Please join me all in warmly welcoming Dr. Muhammad Salam. Dr. Muhammad, the floor is yours.
Well, thank you very much, Dr. Fatin. Good evening, all, and welcome, everyone. Thank you for joining today's webinar. Let me start by thanking our moderator for today's session, Dr. Fatin, and also the colleagues from the IVPN Clinical Research, Dr. Nagam, Dr. Muna Barakat. Also, our greetings should be extended to Dr. Osama Tabbara for giving him the acknowledgement for the huge work that he already accomplished through the IVPN network. and the huge mentoring that he's providing to all of us. Let me start with sharing the slides. Just give me a second.
Yes, I can see the slides.
Right. So to start with, the topic, as Dr. Fatin highlighted, it's about bridging the gap between the traditional way of doing research and action research. Like basically, it's comparing the academic work into the operation management work. And for me, I'm sure that everyone is interested in doing research in general, or most probably had read many articles during the careers, during the studies, and so on. So the traditional research often, while you are in the academic work or the university, answer your inquiries on paper, right? But moving forward, you will definitely start your career by searching for the proper job or career, right? So you need to transform your studies, that what you have gained through your academic work, into practice. And basically, this is what we aim to achieve tonight with elaborations on action research, how it can be useful to your operations management system in different professions, right? Okay. So if we look into the way how action research is taking us from observation into actions, we need to start going back into our academic time, right? On the left, we can see the passive observation of the academia, where you can analyze, you can document, describe all the necessary information during your studies. However, is that going to continue? We need to check, right? It's doubtful. Sometimes, we start works in different careers, in different operations, and we find ourselves, almost using only maybe 10% or even less what we have studied. Now, looking into the right side, we have the active action. This is where the practice, right, lives, where the decisions, when you are start working, you need to take decisions, you have to intervene, you have to transform operations, and so on. So the way how the shift turns observation into impact needs a knowledge into the action research, right? Uh, Now let's compare those two approaches, right? If I can be a traditional researcher, right, I will be saying always, let's work together now, solve the problem, and learn as we go, right? This is the action research. While the traditional research always will look into studies, look into writing, maybe someday that you will benefit or no, it's sometimes not the case. So exactly the one that engage and collaborate is the one that we need to observe and look into during the operations management times. I tried to finalize a definite definition for the action research. So I have searched many references in order to achieve a proper, or to finalize and find a proper definition for the action research, right? Uh, so if we look to the golden side of the action research, it's mainly about participatory action research. It's always involve participants, right? So the research will be with them, not on them. So you have participants doing the research. Usually it's a democratic process involving the voices for everyone, directly involving the teams and the people with the actions. So the golden definition for action research, it starts with an inquiry. It's definitely an inquiry. Like any research type, either it's traditional or any forms of research, you need to have a research question. You need to start your activity with a definite research question. You look for a gap and then start, right, answering your question. So the most suitable definition for action research, it is an inquiry, right, and action that are happening simultaneously together. At the same time, we need to act on what we are finding. I'm sure during your operations management, during your careers and work, you have seen many projects that fail because of what usually the failure happened? Because those projects, they were designed in a way that it involves very few people in the implementation, most probably the leaders and the top management. So you are ignoring the middle management and the normal staff. That is exactly what we are trying to fix tonight. When we talk about the action research, we need to concentrate on the collaborative nature of the action research. We need to concentrate on the outcome measures, the improvements that we need to achieve for our professions. Moving forward, like our objective for the action research, I like the statement when we try to find the objectives is talking about revisioning or to provide a revision, to revision how we look into our research question or to our inquiry. So shifting it from a purely academic exercise to something practical and with a reason or the purpose. Putting a value into your inquiry. Secondly, is to drive the improvement immediately. The management, the top management, right? They will not wait for prolonged periods before they can see the outcomes. So we are not able to wait for many years just to achieve results. We need an immediate improvements. So merging the action research with quality tools might be one of the major activities that we're going to talk about tonight. Thirdly, and importantly, is to close the gap between the academia or the academic programs and the post-graduation practices, turning the theoretical frameworks that we already studied into a real improvement in our systems and the way how we care. We're focusing tonight on healthcare management. Mostly if you work in healthcare operations, hospitals, community pharmacies, or a different healthcare institutions, right? History takes us back into knowing that action research is not something that just appeared recently or a few years back. It went through many decades of evolution. If we look back into almost 100 years, looking into the first time of action research to be part of an idea came by John Dewey in 1930s, where he emphasized that the inquiry, again, you see, we started with an inquiry. Inquiry must combine common sense and science. So he did not focus only on science, sorry. He focused on the common sense. So you need to look into the research that improves, not only the research for the sake of research. He opened the door, right, for looking into a real world scenarios. Then at the same decade and after that, in 1940s, Kurt Lewin took this concept progressively further, founding the action research itself as a tool. He argued that when you are involving the workers, earlier, the industrial revolutions in the 1940s and after the First and the Second World War, usually the laborers or the workers, they are not involved in any process or in any decision making. So basically, they did not have the say in solving problems or in providing practical solutions and so on. So he is considered, Kurt Lewin is considered as the father or the founder of the theoretical framework for action research. Then by 1950s, Stephen Corey first coined the term action research in education. Then in Latin America, South America, the Paulo Freire in 1960s, he already brought expansion to the concept, right? Then Stephen Corey applied it in education. Paulo Freire co-empowered the voice of the laborers in shaping the changes. And in 1970s, Lawrence Stenhouse, in education, in the UK, education institutions, he considered teachers as researchers, right, in the movement, and he implanted the inquiry into daily practices through education. So he first put actions into the syllabus or the curriculums for the university students to start implementing certain changes in the way how they do the research activities. This journey, as we proceed, is showing us a clear pattern, right? That action research grows stronger and stronger each time it becomes more participatory, with participation of individuals that they work together. So it's inclusive and applied. That is exactly what we are aiming to achieve so we need to achieve an action research that empower people. We need to have a proper, right, empowerment for the healthcare operations through individuals or through workforce, through the staffings. Okay, going forward, theoretical framework for action research. Like any type of research activities, the action research is built on theoretical frameworks. It is not a linear process. It is a cyclical process in which the problems, right, are or the issues or the inquiry, the research problem or the inquiry is moved in a cyclic process, not a linear process. And with each cycle, with each and every cycle, you will have a bit of improvement that shapes the progress or the success of the project, right? I have selected some of the common action research models, right? Because there are many, starting with the Kurt Lewin model, okay? Over time, we have from 1945, almost more than 50 theoretical or models about action research. I have selected a few of them, right? Starting with Kurt Lewin, the model which laid the foundation of action research. It focused mainly on the problem identification and evaluating that problem to achieve a decision making on a group level. So he used groups to achieve a proper decision for the problem. Moving forward, 1994, we have Calhoun emphasized on the cycles of data, observing, gathering, organizing, analyzing, and acting, achieving ideal, right, structured educational institutes and hospitals. 2002, we have the Bigot Irvin action research model, brought depth in the reflective core, ensuring we have reflections, as you can see. It is a reflection or reflective core, ensuring improvement in understanding and in continuous learning process. 2007, Stranger stressed on collaboration. So we need to look, think, and act. We need to collaborate, showing that structural change happens when inquiry is collectively, and he iterate. The process is revolving or in a spiral way of doing the inquiry. So the most common feature around all these models are the spiral form of inquiry and the nonlinear progress in the adaptability of the complex operational challenges, right? Here is the relationship between participation, action, and research. This is called the heart of action research. We have three essential pillars or three essential cornerstones that meets in different sides. On one side, we have research, structured inquiry. We mentioned that to generate knowledge. Whatever the research intention is, basically our intention is looking for achieving knowledge. Then on another side, we have the action steps that we need to create for the change that we are looking for. So we have research on one side, then surrounded by an action, and then finally participation as an important element for involving everyone. So the team that doing the research, they are living the problem. They are living the problem. They are part of the problem. They are either generating the problem or contributing to the problem. So they are the owners of the issue. So they are the owners of the issue, taking an action through a proper structured inquiry. This is the heart of what we call it participative action research. So the research that does not only study the change, but drives it with those who are affected by the problem. This integration is what makes the outcome sustainable, right? Because so many, we have talked about the project that failed. So now sustainability of the success is one of the major elements that we looking for during our action research activity, okay? Moving forward, there are many types of action research. We spoke about some of them. The types of action research are determined by the study purpose. It depends on the setup, the level that we look for, the improvement level, the quality change required, the scope, the context, and so on. So it might be a practical, which solves specific local problems in a specific institution, right? It might be a participatory, the PAR, engaging the staff to create knowledge and a meaningful change. It could be a critical type of action research, and this is on a wide community-based, addressing systematic or systemic issues. If there are systemic issues or imbalances, then we call it critical action research. Collaboration or collaborative, that teams, they're working together to achieve or to drive improvement. This is part of the quality improvement projects. And finally, we can say reflective, encouraging the learning throughout ongoing self and group reflections. The characteristics or the features of action research, we can distinguish action research from traditional with certain features or elements. Most important thing is that the social practice, it's rooted in a real context. You can see social practices. It is not isolated in a lab or research lab, right? So it's part of a society or an institution or a context. Secondly, it aimed to improve processes. So we are aiming to achieve tangible improvements, positive changes. Cyclical, we have seen that in the different models. The learning, the acting, the refining, all happening through multiple rounds or cycles. Systematic, driven by structured inquiry. As long as we have a problem, a research gap, then we need to have a structured inquiry. Reflective, it evolves, evaluating what works and what does not. So it's not something that static, it's dynamic process. Participative, involving those who live the problem in shaping the solution. And finally, determined by practitioners. So I decide what action research is suitable for my context. If I'm working as a hospital pharmacist, then I need to look into the major issues or problems that we encounter on our daily practices and what the management is looking to achieve through the pharmacy department. What are the voice of our clients, ensuring that the solutions are relevant, practical, and sustainable. So as a methodology, action research is something that we live and we transform processes via structured inquiry. Like any types of research, you might encounter some barriers, resistance to the whole concept, and you have also facilitators. Knowing your facilitators will lead to success in your action research. So what drives your action research, right, and what holds it back? We need to look into success factors includes commitment. So if you have commitment from the top leadership, then definitely you will be having the major facilitator of your action research. Then culture that supports change, positive changes, right? The major enemy that we encounter during our operations is the comfort zone. People who are really looking to stay stagnant without any change. They don't want to change. We used to do it this way for many years, and it works. Why we have to change? But you might miss opportunities if you stay stuck in your comfort zone. Then one of the major important element is to have a clear vision. It's part of the leadership vision and mission. And finally, the effective communication. The barriers, we spoke about the comfort zone, the workforce instability. The high turnover of staffing is one of the major barriers to change, major barriers for improvements. So workforce instability will create disengaged staff. And the major factor of disengaged staff is the absence of open dialogue, the absence of involvement. They will feel that they are not part of, they don't belong. So we need to reverse that and look into a proper effective communication. So we need to ask ourselves how many of these barriers now, looking into focusing on the barriers itself. How many of these barriers we have seen in our own organizations? And we need to be brave enough to say that in order to achieve any change, we have to overcome at least one or two of these barriers and adapt and change them with one or two of the facilitators. Action research is not happening without a proper structure. So you need to have a checklist. In order to achieve a quality research, you need to look into what are critical factors that we have to consider. We need to look into, first of all, the context. On the left, the factor, and then the question. Part of the checklist is the context. Is the work addressing the real practical concern? Is it something that connect to broader needs of the organization? So the context is very important. We need to assess the quality of the relationships. The core of action research is participation. So relationships are crucial or critical for shaping the decisions, right? Then we look into the process itself, the cycle. The action research is built on cycles. And finally, the outcomes. Using this checklist will ensure that action research is not just an activity, but it is a systematic process that provides an impact and maintains successful change. Then, like any type of research, you must acknowledge the limitation. Like any approach, action research will definitely has its challenges. To cut it short, those are the limitations that you need to include in any action research study, right? The findings of an action research in general, they are context specific. They find a solution for a certain problem. They are limited, right, by certain institutions. Some they look into them as time consuming. Many staff they don't want to be burdened with many additional tasks, right? It is a demanding process because so you have many stakeholders in the process. The long journey of healthcare processes. Let's take an example of medication use processes. It's a long journey that requires or involves a lot of stakeholders, right? In a very busy operations, you can't expect from a busy pharmacist or a busy clinicians to be also doing a research activities, right? In many occasions, they decline. They don't have the time to do a research. Then also, you might look into things from your perspective. So there is always bias. There are difficulty in assigning the responsibility of the research between the main researcher and the participants. And still, so many magazines or journals, they consider the action research as not um, as rigid as the traditional way of academic research. So in order to overcome those criticisms or limitations, many scientists have moved to something called action science, which I like the term. This action science will definitely emphasize on solving the real problems while generating valid knowledge. So it's an action based on a science, emphasizing that to solve the problem, you need to have the proper valid knowledge for all the contributors. It is the collaboration while you are continuously learning. So this is the fruitful mix between academia and operations. So the complexities can be solved with the proper knowledge. Now, integration action research in healthcare, our focus today for the action research is about healthcare. Because healthcare challenges are complex, we need to focus on doctors, nurses, policymakers, regulators, administrators, not only those. Even you have communications with engineering department, IT, paramedics, and we should not forget also the patients themselves. So in order to bring all the voices of the different stakeholders, different people together and co-create solutions, you need to be smart enough and you need to use both the knowledge and the actions you have to merge all of them into a way of thinking to improve your complex processes, right? This is why we're focusing on the healthcare organizations. You might also ask, despite the proven value of the action research, how prevalent it is compared to the normal way of doing research. Surprisingly, I found that action research in healthcare specifically represents less than 1% of the whole healthcare research. So why it's so low? Because of what reasons? Why we are not doing enough in this area? Majority of the scientists in the healthcare profession, they favored over many years, they favored the linear process, the linear studies, the controlled trials, rather than the cyclic and the participatory action research. The trend is changing. As you can see the graph, the trend is changing. For the last 2 decades, we can see how the action research is emerging as a vital tool as we progress with complexities. We had many pandemics. We had the recent one, which was almost a game changer for the healthcare, complex challenges that we have encountered, demanding patients, demanding healthcare systems, competitions, and so on, change the way how scientists are thinking now with the whole evolution of the healthcare profession. So the approach is not optional so far. It's now mandated to merge between your operations and your healthcare science, right? Now, the impact of action research on healthcare outcomes, the beauty of action research is that it delivers some results you can measure, right, in your traditional research, and some you can't. While in action research, measurement is a must, and the results should be something that everyone in the process should feel. Try to find some quantitative benefits of the action research, and then also qualitative. On a quantitative side, right, there is a say always, they say, I believe the guru of the operations management or healthcare quality management, Peter Drucker, said that you can't manage what you don't measure. That means to control and improve something, you must first establish metrics. We call them CTQs, critical to quality metrics, to track your performance, and then you build on your metrics a progress for improvement. For example, in operations management, when we look to healthcare management, you have one of the major metrics that they are using nowadays as a quantitative measure is the waiting times, how long the clients are waiting in all departments, not necessarily only the emergency department or the pharmacy. Almost everywhere now you find the queue systems to measure the waiting times of your patients. The medication errors, a challenging part of the whole process, medical errors and specifically medication errors. Those are metrics that you can utilize to improve your processes. Treatment adherence, optimization of resources, staffing, patient satisfaction, net promoter scores, and so on. On a qualitative side, we can look into engaging the staff. We have seen that the major challenge in operations, the disengaged staff. So you can improve the collaboration, you have stronger collaboration, you can enhance the way how the patient look into the process. We look always nowadays into a patient-centric process to support the changing environment. On a qualitative side, you might also support the changing environment, can empower the staff and foster the culture of innovation with the recent digitalization and AI era. This is just an examples of how common that we have in the recent days. So it's applied globally for change management in healthcare across different disciplines, across different healthcare professions, nursing, physicians, pharmacists, and so on. So this is the same golden principle when those who deliver, so the whole studies share a common principle or a common golden principle. When those who deliver the care receive a proper participation in a certain improvement process, then they will be able to create a stronger, more relevant, and more sustainable outcomes. One of the critical or examples for participatory research in the hospital pharmacy management that already we have achieved or accomplished. And I'm truly delighted tonight to share this example from one of the hospitals in the UAE that we already belongs to. We have created an action research methodology aligned with the quality management, the Lean Six Sigma, creating a seamless connection between identifying the problem and analyzing the data over 19 months. This approach drove real results that we can see in a while, effectively and improving the quality, how the pharmacists, they interact with each other, how the pharmacists interact with the other healthcare professionals. So it was a major step forward to reduce the non-value added steps, to increase the productivity, to source secrets for success in improving the whole system. right? Keeping in mind that everyone belongs, everyone involved, turning that into a collaborative approach as we proceed, right? The study sites involved my hospital, Mediclinic Parkview Hospital, the state-of-art facility located in the heart of Dubai, belongs to Mediclinic Middle East. The hospital was ideal setting for introducing the action research into our organization. It combines both an advanced infrastructure, high patient volumes. So you have a lot of stakeholders in the process, making it a perfect setup or for testing how the action research can improve the real world for the hospital pharmacy operations. Being the last step in the whole patient journey, pharmacy considered as a critical point, either critical point of success or a critical point of failure for the whole system. So it was a central initiative, right, serving the setting, process enhancement directly by improving the patient care, staff efficiency, and operational performance metrics. Very quickly, I know we are almost running out of time. So in a very brief, this is the model that we have used. So the diagram here shows how we integrated the Lean Six Sigma. The Lean is to reduce the waste in the process. The Six Sigma is to reduce the defect in the process. So you combine the Lean tools or Lean principles with certain statistical measures, right, or tools, along with the action research cycle to improve the whole system. Some Lean tools that we have utilized, like the 5S, Kaizen, the PIMIA, the Pareto analysis, and so on. Now, the outcome measures. This is through action research, along with the quality metrics of the Lean Six Sigma, we achieved a significant financial and operational gains. On a financial side, if you improve your patient waiting time, then by default, the money will follow. You will have a proper revenue stream. If you improve your patient satisfaction, then you reduce the leakage to competition. If you improve your if you improve your staffing satisfaction, then definitely you have more engaged and more powerful teams, and so on. So we have selected metrics that are really critical to the quality of the operations of the hospital management, and then we worked on improving them across a prolonged period of time and sustaining the impact, right? So it was a collaborative change that generates a measurable value along with a sustainable outcomes. And we have named the model, the action research model. We came up with the model that we would love other researchers even to adapt and even develop further. It's called Balsam. In Balsam in Arabic, that translates to a balm or a soothing remedy. So definitely the healing or the relieving outcome of this model was similar to the Balsam in our pharmacy operations. It's a very comprehensive model that starts with the inquiry, right, which is aligned with the action research methodology. We define our problem, and then as we proceed, we align it to the DMAC phases with measurements, with the proper analyze phases, and looking into a continuous improvement cycles. And finally, we need to sustain and control the measures. So we have perfectly aligned the quality of the Six Sigma along with the action research methodology in order to achieve a proper outcomes for our operations. Trying to wrap the whole discussion, future directions for the action research in healthcare operations. Looking ahead, we are trying now to become even more impactful in the healthcare sector. Digitalization is now invading all our processes. You have digital tools, you have AI transforming the data collection, the way how we analyze, how we stronger the participations, stronger relationships between the decision makers and the researchers and the clinicians, the managers, and so on. So the shift now is to value-based care, right? Should align with our action research directly and to achieve the outcomes that matters to the patient. Patient is the center of the process for all our systems. So we also see innovation, right, in the resource optimization. Always in your operations, they focus on the cost. They try to reduce the cost of the operation and optimize them, improve the efficiency of the systems. So they don't look into increasing the number of staffing or increasing the number of resources. Rather, they improve the efficiency how we do things. So they look into scaling the existing staff in a context-specific, right, solutions. The stakeholder engagement, right, does not stop on the staff that you have. This is definitely now expanding to the patient, their families, and the communities themselves. So we ensure that improvements are not only effective, but truly sustainable. Those are some questions that came to my mind. I thought to share them with you because we did not have enough time today to explain everything around the action research models and so. So some questions that you might keep them for future if you would like to expand your knowledge in this area, right? And now to conclude, I need to have few, maybe 5 takeaway messages, right? Action research is research in action, not on action, right? It actively involves practitioners for a meaningful change to organizations. We don't look into paperwork. We need to have actions that are sustainable for the organization. Action research treats knowledge as a dynamic and evolving process rooted from the real world practice. The awareness of choices made through the inquiry, right, definitely should ensure an in-depth findings. And ultimately, the action research is about planting seeds under challenging conditions, the seeds that grow into lasting transformation, not only for the researcher, right, but for the organizations and also the communities. Thank you all for your time and engagement today. Please feel free to connect and email in case of any further inquiries or any further information that you would like to have. Thank you.
Thank you so much, Dr. Muhammad. This is very comprehensive, actually, presentation. And I think you covered all the tiny detail about the topic. But anyone, please, if you have any question, you can either unmute yourself and ask your question, or you can type it on the chat and I can ask or read it. Meanwhile, I can actually have a question for you. From your experience, what's your advice for the frontliner pharmacist, for example, to start with the research and action, like the first steps, for example?
The first step thank you for the question, Dr. Fatin. The first step is that you need to come to your work on a daily basis with ambition, like to like what you are doing. It's not like a mandatory task. Today I have to go to the pharmacy. It's not something mandatory that I have to do, although it's mandatory, right? You have to report to your work on daily basis. However, you need to be engaged enough to like what you are proposed to do. And then you need to understand the needs of your clients. We have 2 types of clients in operation management. Like you have the internal clients, and those needs to be targeted first. Your internal clients means your clinicians, your colleagues, your nursing department, your other service providers, and so on. You have to engage with them. You have to look into the major gaps that we have in our operations. And then our external clients, that means the patients. You should be putting yourself in the same position of your patients. We consider the patients, no one would like to be in a hospital or in a clinic, right? Everyone needs to be healthy and having a you need to be in a mall, doing shopping or doing some other
Right.
activities, not in a hospital. So you need to look into the patient from this perspective and ensure that all the gaps in the service are addressed. And definitely the major important part is the safety, because our intention is to treat the patient, not to harm them. Although we can do, so we need to
Mhm.
put the safety of our patients on a medication safety perspective as the top priority and take it from there. So you need to find the major issue to start with.
Yes. It's a way of thinking. It's a new way of thinking and then to implement it. We have another question from Malak. Um, okay, so mainly from Malak, thank you very much, Doctor. I found action research very interesting and I'd like to apply it in both my studies and the practical life. Could you please advise me on how to start? Actually, I think you've covered this.
Yes,
From
definitely.
Doctor, yes. Do you have
Yeah,
anything to add?
the most important is to have a proper inquiry. You need to look into your organization vision. What is the direction of the organization? Are they looking into what is the vision of the organization? You need to live the vision and mission of your organization to start finding the inquiry and you build on it. Engage with the groups and then find your inquiry and build on the success and improvement and make it sustainable.
Yes. So we have from Dr. Noor break. Thank you, Dr. Salam, for your presentation. I would like to ensure that the concept of your presentation, action research, is interesting and important for anyone in health research, reminding me of the concepts of knowledge mobilization and knowledge translation, which the Canadian Institute of Health Research encourages research to consider in their research activity. And she shared the links for the research mobilization guideline if anyone interested. And from personal experience, one of the key barriers to implementing action research, particularly health research, like applying and real world, is the financial barriers and the lack of collaboration within research within the health care system, rooted in policy maker and decision makers. Yes, يعني, as you mentioned, right?
Yes, we have already spoken about changing or enable. We have to find two enablers and we have to overcome two barriers. One of them are the financial barriers. Again, if you convince the management that the action research is the way forward, right? With a simple, you should not have like a huge budgets in order to achieve your outcome measures, right? You need to just show them with a very minimal resources and a very minimal financial budget or requirements how this can transform your operations. I believe if just you show an example for one success
Mhm.
story, either it's a happy patient or a satisfied patient or like a prevented medication error or so. So definitely the whole concept might be mature or they would rethink about it and so on.
Yes, yes, exactly. So thank you so much for your presentation and your effort in this session. It's very insightful and interesting one. You have shed the light on how action research can transform the healthcare operations and at the end the benefits for the patient. Before closing, I would like also to thank all the audience for their active participation and the fruitful questions and comments. Your engagement reflects the importance of the collaborative learning and knowledge sharing in our profession. So on behalf of the organization committee, I extend our deep appreciation to you, Dr. Muhammad Salam, for generously sharing this expertise with us today. And looking forward for future collaboration and if we have more lectures or workshops about this topic. Thank you so much, and thank you for you all the audience, and have a good evening.
Thank you very much, Dr. Fatin, and thank you all. Have a good night. Thank you so much. It's a pleasure.
Thank you. Goodbye.